Hey guys, this is Dr. Lopez from Summit Chiropractic and Sports Institute. We're here just to kind of help out, and give some free advice and some information on different topics. Today's topic that we're going to cover is going to be headaches. So with headaches, there's a lot of people that get headaches. In our profession, being chiropractors, we see quite a few of them. There's over 45 million of people in the United States get headaches. And then most of these people actually would get anywhere up to 15 headaches and more a month. So it's definitely a huge issue. And so with our profession, we're definitely able to take care of those. And today what we're going to talk about is some of the different causes, that bring on headaches. The most common one that we see is what we call musculoskeletal headaches. And these are basically the headaches that stem from having neck pain or having tension in your muscles, or sometimes even nerve pain, that can also lead to these different types of headaches. Some of them can actually be environmental, which means that weather, allergies, sometimes even hormones can cause headaches. That could be hormonal. Sometimes we see these, during menstrual cycles and stuff like that. So those are some other common symptoms. Concussions can be another form of a headache. And sometimes after a car accident, we do see headaches after that as well. Those are acute post-traumatic headaches. So a lot of times, one of the things that what we look at is these symptoms that you're feeling with the headaches. It's really your body telling you that there's something wrong, that there's something going on. So really it's our job to basically go through, analyze everything so that we can get down to the root cause to see which one of these factors could be causing the headaches that you're suffering from. So once we've done the exam and our mobility screen, then what we know, we can come with a diagnosis. And then once we have the diagnosis, then we can move into our treatment portion of our care, which is our mobilized phase. In that mobilized phase, really what we focus on is we focus on mobility, just kind of what it sounds like. When people hurt or when you have these headaches, is because there's some form of a restriction or a contraction in the tissue. And so our goal is to maximize movement so that we can decrease pain. What causes the pain most of the time is that you're trying to move or become active when there's a contraction. So anytime you force that movement and there's a restriction and you go past that barrier, then your pain level goes up. But once we gain that motion, the range of motion goes up and the pain level drops. Right? And so that's really the focus of this phase of our care. And in this phase, really what we focus on is that's where chiropractic comes in, where we can get mobility back in the joint. We do a lot of muscle work so that we can get movement back in the tissue, which is a lot of times the leading cause of some of these headaches. So we'll do some cupping, we'll do active release technique, which is a soft tissue movement that adds mobility. We add massage therapy to this as well. We do muscle flossing as well, which is a type of technique, a compressive technique that helps break up scar tissue. So a lot of these treatments that we do is really to give us the goal of gaining that mobility so that we can decrease your pain. So once we've gained that range of motion and then we've decreased that pain, we want to keep that there, which leads us to our third core philosophy, which is our stabilized phase. And the stabilized phase really is what it sounds, is we're going to do some stability exercises so that we can strengthen your neck, your mid-back, wherever the headache is stemming from. So that way these headaches can stay away, where we can minimize them. So the purpose of these exercises is to minimize these headaches or to make them be less frequent. So as we put these three things together, the analyze, the mobilize, and the stabilize, we at Summit Chiropractic and Sports Institute have had some amazing results in treating headaches and helping them stay away. So obviously we have talked a little bit about kind of how we analyze, how we mobilize, and how we stabilize these headaches. But there's a lot of other types of headaches. So if you are experiencing some of these symptoms and some of these headaches resonate with you, obviously give us a call or see your nearest chiropractor to kind of help them evaluate them and get you taken care of. But if you are experiencing the worst headache that you've ever had in your life, or a headache that's just not going away and is pretty intense, something that just seems abnormal, then you should probably seek immediate medical attention.